Conversation around masks and their proper use is something leaving a lot of people with questions. So we decided to talk to someone who is intimately familiar with their use. Dr. Huang is a former deputy medical health officer in Saskatchewan. She oversaw public health programs in the province for the past 5 years, and we reached her today in Saskatoon. Dr. Huang, can you walk me through the three most popular masks we're seeing right now, the paper, the N95 cloth, and their intended uses?
Definitely. So the N95 respirator refers to a specific certification by the United States National Institute for Occupational and Safety and Health. So the N95, if worn properly, has a filtration efficiency of at least 95%. And when used in the medical setting, it could filtrate, remove the respiratory viruses or bacteria. When we talk about mask, we're thinking about the surgical, or it's sometimes called procedural mask. And those are masks that we commonly think of when we think about face masks. And these are the ones that's worn by surgeons or operating room nurses. They're made of specialized non-woven materials with electrostatic charges. And what it does is it protects the patient in operation, so their wound and sterile site do not get contaminated by the respiratory droplets from the surgeon. It also protects the healthcare providers working in the OR. And then the other one is what we're talking about, sort of homemade cotton cloth based mask. And that's, I think, what's generating quite a bit of discussion right now with the changes in recommendation from the U.S. Center for Disease Control, as well as the change in recommendation coming from the Peptide Agency of Canada.
So how do people properly dispose of or clean these masks?
So the medical masks, the surgical procedural masks, are meant to be worn only once. And once it becomes moist or difficult to breathe, they're supposed to be disposed of properly in covered garbage. Same thing as N95. Now, if we're talking about the cloth homemade mask, then the intent for that is to block the droplets or micro droplets when someone is speaking, or if they sneeze and cough. And the same thing and the same principles whereby soaps and water can kill the coronavirus. Laundering these cloth masks in our laundry machine can do the same. But what they should do is, what we should do if we choose to wear them is make sure you wash your hands before you put on a clean mask. And once you're wearing it outside, consider the outside of that mask as contaminated. And so when you're removing it, take care, once you are removing it, you can remove it from the ear loops. Take care not to touch the outside of that face mask. And if you do not touch your eyes, nose, or mouth. And put it in a plastic bag, seal it, and dispose of it properly, so then you do not contaminate the environment once that mask is worn, and before you wash it.
Dr. Huang, in your medical opinion, do you think people should be wearing masks or face protection while out in public right now?
That is something that's actually a recommendations that we've seen in Southeast Asian countries that have been quite successful at containing COVID-19. Now, there's the thought that we do not have evidence to support the widely use of masks in community setting. However, with the recent evidence and what we know now with the science is that, number one, COVID-19 can be spread by people without showing any symptoms, and they're most infectious at the time of developing symptoms, or just a few days before it. And so wearing the mask, if everyone wear a mask, it will prevent people who are infectious from spreading it. And if you're out in the public, we still need to do the physical distancing and 2 meters apart. However, you will notice that it's much less than 2 meters when you're paying for your grocery, between the cashier and yourself. And so situations like that where you're indoor, I would encourage that people consider using a cloth mask, even because it will protect. By you wearing it, you are reducing the risk of you spreading the infection to others, but it will also protect ourselves, even though we do not have study demonstrating that just yet.
Thanks for your time, Dr. Huang.
Thank you.
Dr. Huang is a former deputy medical health officer in Saskatchewan.